Hi, my name is Lance Gray. I'm going to be doing a cardiovascular and pulmonary assessment here on Alexa. So I've already came into the patient room. I've provided privacy. I've done hand hygiene. I've identified the patient. So, hi Alexa, my name's Lance. I'm going to be your nurse today. I'm going to be doing a cardiovascular and a pulmonary assessment. I'm just going to look at your chest and then move to your heart, okay? Alright, so when I walk in, I'm going to look for the configuration of her thoracic cage, and I'm going to look at her shoulder and muscle symmetry. I can tell that there's no abnormalities noted of her thoracic cage, and her muscles and shoulders are symmetrical. So I'm going to go ahead and move to the back here. I'm going to palpate for any tenderness or any masses. See, palpate here. Do you have any tenderness at all? No, any masses I should know of? Anything abnormal? Palpate chest. Okay. Now while I'm back here, I'm just going to go ahead and do symmetrical chest expansion, and this is where I'm going to have you kind of sit up for me just a second. And I'm going to take my hands and I'm going to put it in the middle of her back here, and I'm going to get a little skin in between my thumbs and fan out my fingers, and I'm going to have her take a deep breath and breathe out. And this here, I was checking for her how well her lung fields expand out, and her chest is symmetrical. When it expands, I can feel that with my thumbs as my hands expand out with her chest. So while I'm back here, I'm going to go ahead and do the tactile affirmatus. And this here, I'm going to have her say 99. So I'm going to put my hand on you when you ever feel that, say 99. And here I'm checking for any abnormalities or any differences between each side. So if you'll say 99.
99. 99. 99. 99. 99. 99.
Alright, now I'm going to move to your chest here. You'll say it again.
99. 99. 99. 99.
Okay, good. There's no abnormalities noted, no differences with her saying 99 at all. So now from there, I'm going to go ahead and I'm going to move to the next test. I'm going to percuss the posterior lung fields here. So I'm going to be listening for a resonant sound. I don't want a dull sound until I get past the lung fields, in which when you get past the chest, you would hear a dull sound. Good. There was a resonant sound, there was no dull sound, no abnormalities were noted percussing. So from there, I'm going to go ahead and move. I'm going to auscultate her breath sounds. I'm going to listen to her posterior first and then move to her anterior. If you will, just take a deep breath whenever you feel my stethoscope. Okay, good. Her lung sounds on the posterior side were clear, and there was no signs of wheezing or crackling. Her breath sounds were unlabored. So I'm going to move to the anterior. I'm going to start with the bell here. If you will, turn your head. Deep breath. Other side. Okay. Good. And the anterior lung fields were the same as the back, as they were clear. There was no signs of wheezing or crackling, and her breath sounds were unlabored. She had no problem breathing. Respers, the depth and rate were regular. So from here, I'm going to go ahead and I'm going to move back here. People just kind of sit up. Yeah, we're going to do 3 tests. The first one is whisper pectoriloquy, and that's where I'm going to have her whisper 1, 2, 3, and I'm going to listen, and I should not be able to hear her say 1, 2, 3. Move to the front. Good, and I cannot hear her say 1, 2, 3. So now we're going to move to the next test, which is the bronchophony, and this is where I'm going to have her say 99. And I should be able to hear her say 99, it just probably won't be very, it won't be able to hear or understandable what she is saying. But if you will, when you feel my stethoscope, say 99.
99, 99, 99, 99, 99, 99,
Move to the front.
99, 99, 99, 99.
Good. And with the bronchophony, there was I could hear her say 99, but it wasn't clear or understandable. So we're going to go and move to that egophony. And this is where I'm going to have you say E, and I'm going to be listening for an E sound and not an A sound. So if you will say E when you feel my stethoscope.
E, 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 E,
And the front here.
E, 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 E.
Good. And the E sound was noted in all different spots and no A sound. So now from there, we're done with the thoracic assessment. I'm going to move to your heart, okay? So first I'm going to move and I'm going to listen to her heart at the 4 different spots. So we're going to do first the aortic, then the pulmonic, then the mitral, or the tricuspid, and then the mitral, which is where I'll listen to her apical pulse for it's supposed to be a minute. I'm just going to do 30 seconds for the video's sake, but in the hospital setting, we should go ahead and listen to it for a full minute. So I'm going to start here. I'm going to start with the bell, and I'm just going to listen with the bell. Okay, now I'm going to go ahead and move to the diaphragm. And this is where I'm going to listen for 30 seconds, okay? And in 30 seconds, she had 35, which we'd multiply by 2 and get 70. Like I said, in a real setting, we should go ahead and listen to it for a full minute. So now that we've got our apical pulse, the pulse was regular. She had a regular S1, S2, and there was no murmur noted. So now I'm going to go ahead and I'm going to palpate her carotid artery. I'm going to do one side first, and then the other. Make sure not to do both of them at the same time. Okay, now I'm going to auscultate. So I'm going to listen. And the other side. Alright, and that's the end of my assessment. Thank you for letting me do the cardiovascular and pulmonary assessment.